have a multidisciplinary approach to meet the child's therapeutic needs is an incredible thing.
We're afforded a lot more flexibility, and therefore we can be quite creative about when we get involved with the young people that maximises their likelihood of talking to us.
One of the benefits I found is building that connection before even trying any intervention. Thinking of a young person that we recently supported who has made incredible progress, and this young person very bravely opened up about some of their difficult experiences, and we were able to help them and put the right support in place immediately, which was great.
Hello there, my name's Dr. Paula Corredor Lopez, and I'm a consultant clinical psychologist working at SuperCare as part of the therapy team.
Hi, my name is Dr. Laurie Preston, and I'm a clinical psychologist working in the in-house therapy team at SuperCare.
So whilst we've only got psychology representation here for this podcast, we actually have quite an extensive embedded in-house offer and therapy team that works solely at SuperCare. So I understand that this is quite unique. Do you want to tell me a little bit about your experience of working within that therapy team and what it brings to the residential home settings?
Of course. So we have psychology, we also have occupational therapy, speech and language therapy, a positive behaviour support practitioner, and we are hiring a dietitian currently. So this is a really unique offer within residential services. To have a multidisciplinary approach to meet the child's therapeutic needs is an incredible thing. I think SuperCare wanted to try and address the difficulties that parents have expressed in terms of accessing therapeutic support within community services. So we understand that children's mental health services, for example, are under immense pressure, and it can take time for children to access these resources.
And meeting regularly to support a parent who still has parental responsibility for the placement for while their young person's living with us. And she'll often say to me, and I'll hear her say it time and time again, I know he's going to get the help he needs now. And it's something about us being there, and where there has been CAMHS involvement before, I note that it hasn't necessarily always been as beneficial as the families would like. And I think part of that, honestly, is that our CAMHS models aren't necessarily always as flexible to be able to afford that time catching the young person, before they head off to their educational provision, or being there when they want to go for a walk down at the beach, or, going paddling with them. We can't always engineer that when we're in quite a sort of structured CAMHS setting. But because you and I are in the in-house team, we're afforded a lot more flexibility, and therefore we can be quite creative about when we get involved with the young people that maximises their likelihood of talking to us.
And I think another benefit is that we have an unlimited amount of time to build relationships with the young people. So we can build trust, build rapport, and work at a pace that feels appropriate for that child, because they may not trust professionals, they may have had negative experiences in the past. And also, if they've had multiple placement moves, then they've had to meet lots of different adults that they don't know, and are encouraged to engage in interventions that they don't really understand why they're being asked to engage in. So one of the benefits I found is building that connection before even trying any intervention. And I'm just thinking of a young person that we recently supported who has made incredible progress, and it is all relational. It is all about how you feel safe, connected and attached to the people around you. And this young person very bravely opened up about some of their difficult experiences, and we were able to help them and put the right support in place immediately, which was great.
I'm struck by how you and I get the opportunity to choose who we want to open up to. And sometimes when you're referred into services, you don't necessarily get to choose who's sat opposite you in your appointments. And It's the same still within a residential space, but there are lots of other adults around, and it might be that we find ourselves as psychologists supporting young people through a trusted adult that they have developed a particular bond with, one of our coaches, one of our other team members who might not be you and I, but that person has opened up to them, decided that they're their person, that they want to build a relationship with that person, and then we might choose to support the young person through that relationship, and that's fine too. It doesn't have to be you or I. It certainly doesn't have to be a conversation sitting across a table in the traditional sort of therapy kind of space that we might imagine. We can just reimagine it and just adapt it to what that young person needs. And I think that's the exciting part of working in this way. And that's what gives the role energy and possibility. And yeah, you can bring your creativity to it in order to maximise the possibility of them engaging in what can be really quite difficult conversations at times, right?
Definitely, and I think that's really the only way you can work with young people who are firstly traumatised and secondly, experiencing neurodevelopmental differences, learning needs. I think being creative, being slow, not being as directive, but allowing the child to open up at a pace that feels right for them. Sometimes some of our sessions, as you've described, can be on a trampoline with a child where you're playing for 10 minutes and then the child chooses that moment to disclose or to open up or to share what they're experiencing. And that means that you can then have those conversations when they're ready. Whereas when you access maybe mental health services, you have a set time, a set appointment with a set clinician, and maybe that's not the right time, or the child's not in a place to share or disclose at that point. So it's a real privilege and it's a real benefit to having an in-house team. And I've yet to meet or work with other services that have such a wide-ranging, multidisciplinary team of therapists. So I really value that about SuperCare.
I like the opportunity also to do joint sessions,
yes,
because you don't necessarily get that opportunity when you work in statutory services, because you're waiting on the OT waiting list or you're waiting on the psychology waiting list. You don't get them sat in the same room together, and yet I learned so much from attending a sensory assessment of a child's needs or hearing from that parent. And you think, why don't I know that? When you've been working with a parent for so long, perhaps, or with a young person for so long, because it's a different angle to approach the assessment of their needs, and it throws a different light on the work that you can then integrate into your own interventions or support for a young person.
Definitely, our speech and language therapist has helped me adapt my therapy resources to meet the developmental needs of the child, and our occupational therapist has actually supported me in sensory regulation strategies that are tailored to the child's preferences and needs as well, which I've never had the opportunity or the luxury of that, of doing that before. So it's a real value, it's a real strength.